up if you guys can hear me okay.
Just going to say welcome, everyone. We're having a few technical difficulties, so just bear with us another minute.
Okay, I think I'm back. Can you guys hear me okay now?
Yes.
Great. Welcome, everyone. We're so glad that you could be here with us tonight. My name is Ann Dolid, and I'm the principal at Havens Elementary School. Along here with me tonight is Carol Kramer, principal at Wildwood. I'm going to give a wave, Carol. You're kind of frozen for me, but hopefully people can see you. Michael Coratone, principal at Beach. Stephanie Griffin, who's our director of instructional technology. Our 3 district nurses, Carol Menz, Amy Jo Goldfarb, and Claudia Garcia. And then Dr. Wozniak is here as well. She's going to help us with moderating tonight. So want to review quickly our agenda for everybody. I'm going to be doing most of the presenting tonight. Just tends to go a little smoother rather than jumping between a bunch of different voices. So here's our agenda for tonight. The focus tonight is on health and safety and how we're going to ensure that students are well cared for when they're here, while also ensuring the health and safety of everybody who's on our campuses. We're going to try to paint a picture for you of what a student day is going to be like. So we're going to walk through what a student day is like, starting from the health screener, from the time they come on campus, all the way until when they go home. We're also going to walk you through what happens if a student becomes symptomatic while at school. And finally, we're going to explain what we're going to do if a child does not pass our screener and is not able to come to school on any particular day. And that will all make sense by the end of our presentation tonight. At the end, we will have some time for questions as well. But before I go on, I'm going to turn it over to Dr. Wozniak just for a couple of minutes, who's going to explain a little bit about our structure tonight.
Thank you, Ann. Good evening, everyone. Just a huge welcome to this evening. I know it's been a long time waiting. We are so excited that we are very close to welcoming our kindergarten through 5th grade students back to campus. So just a little bit about our structure as far as how do we moderate or how do we handle our question and answer portion of this. So we did a lot of thinking about how to have this go as smoothly as possible. And so with, between 350 to up to 400 people, what we have is a structure where in the lower right-hand corner, you'll see a link to a Google form, and there's a shortcut there, PUSD open queue there. So you'll be able to see that. If you type that into a browser, you're going to see a simple Google form that allows you to enter a question. And those of us who aren't presenting will be reviewing the questions. And we will do our very best to answer as many questions live tonight. But again, if everyone or half of you asked a question, we could easily have 200 questions populate. So our plan for this evening is that we'll spend some time answering questions live, and then we will have a collection of all of the other questions that come in, and we will do a follow-up by reviewing those questions and kicking out an FAQ, organizing those responses. And as Ann mentioned, we have our nurses on standby, but again, there could be questions that we would want to consult with them first. So we really want to give you as much information, and we do think we've anticipated many of your questions tonight, but if you have them, go ahead and use that link to give us your questions. We will review them, and I'll be moderating. So we'll go all the way through the presentation, and then I will ask some of the principals to respond, or Stephanie and I will respond. We may call in one of the nurses to respond, and direct the question to them. But anything that's not answered live tonight, we will do a follow-up and send that out to all parents, because we know there are many parents who wanted to be here and it just may not work out for some reason. So, so again, huge welcome. And with that, I'm going to turn it back over to Ann.
Thank you so much. All right, let's get started. We are going to start with what you are going to be doing each morning before you send your child or children to campus, and that is our health screener. Stephanie has done an amazing job getting this launched. It's been pretty amazing to see just how the functionality of it and how specific it can be. So I'm excited to show you how it works. So you wake up, maybe you're in the morning cohort, maybe you're in the afternoon cohort, but regardless, you're going to be getting a unique link sent to you via email every morning. It can also be set up to come to you via text. It's a unique link for each child. So if you have more than one child in the district or in the elementary schools, you'll get more than one email or more than one link. Easy to miss that second email because they stack. So you might have to click down through them to see both of them. Just a little tip. It's the parent's responsibility to assess your child before you complete the screener and monitor any changes and symptoms that might develop through the day. Meaning if a child, you might fill out the screener in the morning when they wake up and everything's great, but then they get a sniffle a little later in the morning before they come to campus for their afternoon cohort, you would be going back in to amend your screener responses to be accurate for that particular day. We do ask that you complete this a minimum of 30 minutes prior to returning to campus. That's so that we have all of the data in the system so that we can be checking students off when they arrive at campus. So the very first screen you'll see when you click your screener link asks this: have you tested positive? The you is your child, not you as the adult. Have you tested positive for COVID-19 in the last 4 days? You answer yes, you answer no, or you could answer yes, and I've already completed the contact tracing. That would be if you'd answered yes on a previous day. The reason for that third question is because we do want people to complete this daily, regardless of whether or not they're coming onto campus. So if you answer yes, then it stops you. It says, sorry, you can't come to campus, and then somebody will be following up with you. If you answer no, it'll take you to the next screen. And if you say yes, and I have already completed the contact tracing, it stops you there as well, because we know you're not going to be coming to campus that day. So if the answer is no, it takes you to the next screen. Will you be on campus today? If it's a Monday, you would answer no. Or if you have a medical appointment and you know your child's not coming to school that day, you might answer no. But generally, you're going to be saying yes. And when you do say yes, it'll take you to this screen. Once you populate the screen once, it does hold the information. You don't have to do it every single time. So if you would prefer to get your health screener via email, then you would click the yes box and you would type in your mobile number, at which point you would start getting a text each day in addition to the email. The email will still come, but you'll get the text message as well. Once you do that, it takes you to this next series of questions. It asks, in the next 14 days, have you had close contact? It does define what close contact is for you in case you need a refresher. It's defined as within 6 feet of a COVID positive person for 15 minutes or longer, which can also include shorter bursts that in total is 15 minutes or greater, even if everybody's wearing a mask. So you get this, this screen, you'll say, yeah, we've tested positive, or that you've been in close contact, or none of the above. Assuming that you say none of the above, if you say that you have been in close contact, it does stop you and say you're not cleared to come to campus. We have lots of places where it's checks and balances to make sure that we get the information we need. But let's say you say none of the above because everything's fine. You have no close contacts that you're aware of. It takes you to this screen. This is probably going to be the hardest thing for parents to remember to do each day. But we do ask that you take your child's temperature each morning and respond yes or no. If they have a temperature of 100 degrees or higher, again, you'd answer yes, and that will stop you and say you're not cleared to come to campus. But if you say no, it will take you to the next screen. And this is where it starts to do the symptom check. It asks, do you have any chills, a cough that's new or worsening, recent decrease in sense of smell or taste, or none of the above. And again, the you is your child when you're filling this out. You're not answering for yourself as the parent. So let's say no, and it takes you to this next screen. And it asks for sort of that laundry list of symptoms that we're pretty used to seeing at this point: runny nose, sore throat, aches and pains, tired, nausea or vomiting. This is going to be one that I think is going to be hard for people, along with the diarrhea. You know, sometimes kids get diarrhea for no reason, or they throw up in the middle of the night and it doesn't seem connected to anything. But when you have to answer honestly, and when you click yes, that does mean that you're not cleared to come to school that day. We have to treat every symptom like it could be COVID positive until that's ruled out by a test. But this child today doesn't have any of those symptoms, so they're through. Hooray. It only takes 30 seconds. I know that took a little bit longer because I was walking you through. We as staff members do it each day before we come onto campus, and it really only takes 15 or 20 seconds, not too long at all. So let's say you're cleared, you'll see this screen with the green check. That means that you're good to go, ready to go, and that will get loaded into our system. So you don't actually have to bring that to school with you. If you've done it on a computer, you don't have to print it out or anything like that. We'll be able to see it on our the app that we use that goes along with the screener. But if you answered no to any of those questions or yes to a fever, you will be stopped, and it will ask you to stay home in all caps. And then it will prompt you to also call the attendance line to report the absence. The two systems don't speak, so we do need you to take that additional step to make the phone call. I will add, and I know I've done this once or twice before, I accidentally clicked the wrong button and it stops me. And it's like, oh no, but I really have to get in. I have a meeting in a few minutes. It does allow you to retake the screener so you can update your record. That's the same thing I referred to earlier. If your child develops a runny nose or a sore throat over the course of the day, and now you do need to keep them home, you could correct that. It's possible that you might have a question about the screener or you fill it out incorrectly. There's two contact numbers here. This is another information that we've already pushed out and that we'll continue pushing out. But if you need help with the screener, you're going to email IC help. That's the same email address that you email when you need to update or are having trouble updating Infinite Campus. So that should be familiar to you. Or if the screener doesn't work properly, like you get a spinny wheel and it won't let you pass, anything like that, you could email the IC help desk. If you have a health related question, like, I think maybe that's a symptom, but I'm not sure, answer assuming that it is a symptom, and then you can follow up with the health clerks. There's one assigned to each site, and this is their generic email address. It goes to all three of them, and they can support you with answering those questions. Okay, so you filled out your screener, you're cleared to come to campus. We're all here ready and ready to see your kid, ready for the day. What's gonna happen then? So you're gonna arrive at your designated entrance. And again, we pushed all of this information out last Thursday. We'll be sure to send it out again, but there are slightly different systems at each of the school sites. But when they have their screener checked, there are the three possible outcomes, two of which I've talked about pretty extensively already. One is that they're certified. They got that green check mark. They're ready to go. The other's not certified, which means that they need to go home because they didn't clear the screener. So in that instance, they'll either go home with the parent if the parent's still with them, or we'll escort them to the health clerk, and the health clerk will be calling parents or guardians to pick up. Or it's also possible that you thought you did the screener and didn't click all the way through it, or that you just forgot, because that happens too. And in that instance, whoever's checking the screener will let you know if you're still there. Hey, I don't think you completed the screener today. You can pull it back up in your email if you have a phone with you, and get that taken care of. If the parents left, let's say it's a fifth grader who's walked themselves to school, they'll head over to the health clerk and we'll be contacting you to complete the screener for them. We will not be letting students into classrooms until they've passed the screener each day. It's non-negotiable. I know it can be inconvenient, and often we've been in the habit of like, oh, it's okay, we'll take care of it later. You know, bring that piece of writing in tomorrow, no big deal. But on this particular piece, we can't be flexible at all. Students have to be certified in order to enter our classrooms. Okay, so they're certified. They are on the beach blacktop, all lined up with the pancake guy, ready to be picked up by their teacher. Their screener's been checked. Now what? They're going to be walked to their classroom. They're going to maintain social distance. They're going to have their mask on, just like they've been practicing for the past almost year now. And their teacher's going to be in the classroom ready to greet them. You can see from this image, you may have seen pictures like this before, that our desks are spaced out. Students are 6 feet apart. The teachers keeping some social distancing too, greeting the students and waving hello. So when this is just sort of a little flow to see what the day will be like. Again, we've talked about these first two on the top already. At Haven, students are walking straight to their classrooms. At Beach and Wildwood, they're lining up. They'll be greeted by their teachers. They'll enter their classrooms. They're going to bring all of their belongings in with them. We're not going to be using hooks the way we have in the past. They're going to bring their materials to their desk and they'll just place them at their feet, and the teachers will do all of the magic live and in person, what we've been waiting all year for. At the end of the day, during the day, you know, we want students to bring a water bottle so that they can have a sip of water if they need to. They're going to have their own materials with them. During that 2 hour and 15 minutes, teachers might choose to utilize our outdoor spaces so that the kids can get some fresh air, maybe play a little community building game outside, and then come back and finish up more work while they're in the classroom. Students need to go to the restroom. We are limiting the number of students that are allowed in the restroom at any given time. We're only letting 2 students in the bathroom. That's the maximum capacity for most of our student bathrooms. There might be a few exceptions there. And we're going to be leaning in and teaching the students and reminding them to check to see how many people are in the bathroom before they go in, to make sure that we're keeping them safe in those spaces. At the end of the day, they are going to pack up their things. Teachers are going to support them in maintaining social distance and getting to the exit where they're going to be picked up. And then we'll repeat the whole thing again the next day, assuming that it's a Tuesday through Friday.
Anne?
Yes.
Could you clarify? I think we had a typo on one of our slides. It's come to our attention that the morning cohort slide lists that the cohort ends at 10:15, and that should actually say 10:45.
Correct. Sorry about that.
So we've answered that one. That is a typo, our mistake. So that question, thanks to all the parents who quickly put that into the Google form.
Sometimes it doesn't matter how many times you edit, there's something still slips through. Just a reminder that Mondays remain the same. They will be in the exact same format that they are currently. They will be 1 hour of synchronous instruction with the classroom teacher. The remainder of the day will be asynchronous instruction. No students will be on campus on Mondays. That is an all distance learning day. Okay. So what happens if a child comes to school? We think they're fine, they clear the screener, they are peppy and energetic and ready to go. And then partway through their time on campus, it's clear that they really don't feel good. They're coughing, they're sneezing, they have a runny nose, they have, you know, they're glassy eyed, and it's clear that they just don't feel good. When that happens, the teacher is going to have the student go to our sick bays. That's where our health clerk works, and the health clerk will take it from there. When a student does develop a symptom during the school day, we ask that a parent or caregiver pick up that child within 30 minutes. Really anything that could be a symptom of COVID-19, we have to treat as if the child has COVID-19, and they will be expected to isolate for 10 days following the onset of those symptoms. it's really important that we follow that practice in order to ensure everybody's health and safety. We do ask that our health clerks are amazing, but we do recommend that you reach out to a healthcare provider if this instance happens for your family. So again, health clerks will contact you, ask you to pick up, you'll contact your physician. The student has to isolate for 10 days following the symptom onset. Basically, what isolating means is that they shouldn't be around anybody else at all. Of course, that's not realistic for small children. They'll need a parent around to support them, but they truly should not be with others while they're symptomatic. If this is the case, we also want you to consider having a COVID-19 test before they return to school. In order for a child to return to school who has developed symptoms, it's 10 days or a medical note. And what we mean by a medical note is a note from a physician, a nurse practitioner, a physician assistant stating that the healthcare provider is confirming that the symptoms are not COVID related, or they are verifying that they've had a negative COVID test. It has to be a PCR test or a molecular test. A rapid test does not meet the threshold, nor does an antigen test, or a rapid antigen test doesn't meet that threshold, sorry. It has to be the PCR or molecular only in order to meet that threshold to return to school. In addition, the symptoms have to have had improved, including not having had a fever for 24 hours. So it's a pretty high threshold, but we want to keep everybody as healthy and safe as possible. Also, just want to clarify quickly for everybody, this is something that our amazing district nurses have had to talk to me about multiple times, like, and the difference between quarantine and isolating is, because it is a little bit it was counterintuitive for me. It might not be counterintuitive for you, but having to isolate is more restrictive than quarantining. Isolating means that you should not be in touch with really anybody else. Of course, if it's a child, you're going to care for them. Whereas quarantining means that you need to limit your exposure to other people because you may or may not be developing COVID-19. So that's the case where it's like, oh, I've had a close contact. I'm going to stay in my home. I'm not going to go to my activities. I'm not going to go to school, so on and so forth. We're going to get to this in a minute. Maybe I'm jumping the gun. I don't think I am. When we ask, one of the things that's also a little bit counterintuitive, and you'll see this in the health basics that we sent home, is that the quarantine period, meaning I've been in close contact with somebody, is 14 days. But the isolation period, if I'm sick, is only 10 days. Why would that quarantine period be longer? Well, the reason is because the virus incubates, and then there's another period of time before symptoms would appear. So that's the reason for that longer test, or that longer window of time that we're requiring students to stay home. I'm sure there will be, I'll try to clarify that a few more times as we're going through the slides tonight. So just to summarize, a close contact is you've been in touch with somebody who is COVID positive, or your child's been in touch with somebody who's COVID positive for more than 15 minutes. Mask on or off, it doesn't matter, it's still a close contact. If somebody has symptoms, they also have to stay home. And if they have a positive case, of course, they're going to have to stay home until all of those symptoms clear. Okay, so what does your child do? I'm sure some of you have already typed this question in, and I was getting to it. What happens with your child when they have to stay home for 14 days or for 10 days? Their cohort's still in school. What happens for them? We are very fortunate to have a position in the district that is assigned to support students who are quarantining or isolating because of a close contact, a positive case, or symptoms. We're calling that person our distance learning coordinator. And they will be sort of picking up the ball for those students. A child who's self-isolating or quarantining will be able to access their asynchronous work just like the rest of their class, They'll be able to participate in their teacher specialist classes, no problem. Those are all distance learning. But when it comes to the live instruction, obviously they have to sit that out. And so that's when our distance learning coordinators would step in to provide the instruction that is needed. It won't necessarily be 2 hours and 15 minutes, depending on the number of students they're supporting. It might be 45 minutes for third graders, all the third graders who are in that category. Or if there's only one student at a time, it might be the full 2 hours and 15 minutes. It's going to be very fluid, and it's going to depend on the number of students that we're needing to serve in that setting. We know that if your child is having to quarantine or self-isolate, that is stressful, but we do ask that you're flexible and understanding and recognize that it truly is a gift that we're able to provide this position for students that aren't able to come onto campus. We worked really hard to make sure that could happen, and I'm so glad that we were able to. Want to talk through a couple of different scenarios, because I think this is where all of our heads probably are at this point in the evening. What happens if my child is in a cohort and there's a positive case within that cohort? Now what happens? The first thing that happens is a confidential notification is sent out so our district nurses do all of the contact tracing along with the health clerks to make sure that anybody who may have been in close contact with that person while on campus receives a notification that they were potentially exposed to COVID-19. We don't tell you where the exposure came from. We don't name the child. That would be a violation of private health information. But we do let you know that you were that your child was potentially exposed. That entire cohort will move to distance learning for 14 days. So it doesn't really matter who in the cohort sort of had the exposure or provided the exposure was the positive case. Everybody goes into that distance learning cohort. Everybody just moves back to home, but the school remains open. There's no change there. And in that case, the teacher's other cohort will also move to distance learning because we need that teacher to be teaching the students. And so if we don't have a teacher on campus, then both cohorts will move to distance learning for those 14 days to make sure that kids get the best possible instruction. And again, we've already talked a little bit about what is considered close contact and exposure, but that definition is here for you again. I think another really helpful way to sort of think about this is a first degree of contact or a second degree of contact, because I know some of you might be thinking, okay, well, this happens in my second graders cohort, but what about my fifth grader? If your fifth grader has not had that contact, they haven't been in contact with the COVID positive person, they can continue to come to school and participate in their cohort. If that second grade sibling comes down with COVID-19, then the fifth grader would now be moving into a isolation or a quarantine period of 14 days. So just a reminder, you keep your child home from school when they have any health symptoms, when they have a possible exposure, or when they've tested positive for COVID-19. And when that happens, we still want you to complete the daily health screener. That's how we know to do our contact tracing. And also to email or call the school attendance office. Oop, and I have a typo on this slide too. Sorry, what else am I missing? That was my note to myself. I apologize for having that in there. So I think the most important thing is that, and we talked to our counselors about this as well, that when you're talking to your child about this, that you stay calm, that you make sure that you're in the right state of mind to be talking to your child about returning to campus. Most kids are pretty excited, but some might also have concerns, and you might have concerns too. You can have many feelings at the same time, be excited that we're going back, but also feeling a little bit nervous at the same time. So make sure that you're in the right state of mind to talk to your child about returning. Ask your child how they're feeling and ask them why they're feeling that way, because that'll give you really nice insight into how to respond. Two key words there are acknowledge and reassure. Make sure they know it's okay that they're having the feelings that they're having, and reassure them that that they're going to be taken care of by both you and by their teachers. Answer the questions that they ask. This is a pretty standard practice for talking to kids. You know, ask the question that they ask, don't give more information than they need, and don't dodge the question either. Explain to them what will be the same and what will be different. This is a great time to practice walking your family in a line, a socially distanced line with your masks on properly. Practice washing your hands, remind them of the birthday party or happy birthday song while they're washing. And then pretty soon you'll be getting welcome back videos and messages from teachers where you can talk, share those with your children so that they can see a visual of what to expect. And then I think also really important to reassure them that all the grown-ups are doing everything that we can to keep people healthy. But also within there, if they say, but can I still get sick? Yeah, you can. But if we're really careful, the chances of getting sick are less likely, right? We all know that. We've been hearing it from all of the health officials for almost a year now. So don't promise them that they're not going to get sick or that other people aren't going to get sick, but just remind them that if they're safe and if other people practice appropriate hygiene and mask wearing, that we have a better chance of staying healthy. What else am I missing, guys? Did I get it all, everyone? Okay. This question has come up quite a bit. How many activities can my child participate in at any given time? The current guidance is that children can participate in school and a child care setting. So that's one school cohort and one child care cohort. An example of that, of course, is schoolmates. But if you have multiple babysitters or they're going with one group of friends for childcare on Tuesday, Thursday, and another on Monday, Wednesday, no, that doesn't meet the health guidance. You need to consolidate those into a single child care setting. And then in terms of extracurricular activities, I know that this is a big one, particularly for those with older kids. Students are only allowed to participate in one extracurricular cohort or camp at a time. So if you're doing soccer, you can't also do swim team. If you're taking a carpentry class, you shouldn't be on a ski team. You should only be doing one at a time. So that brings us sort of to the end of all of our health and safety information. Of course, there is so much more, lots of site-based logistics. The three principles, we're going to be working on pushing this information out in different ways, and we'll have other opportunities for parents to ask questions about where to go and what to do. Classroom teachers will also be helping with this because they're going to have certain ways that they want things to be done. And so that'll be a sort of a collaborative communication effort between the principals and the classroom teachers. And you can certainly keep an eye on highlights and try not to click past those Infinite Campus messages for the next few weeks as we continue to share information. And that brings us to the end of our presentation. I'm going to turn it back over to you, Cheryl.
Thank you, Anne. All right, so just to give everyone sort of an idea, we have over 40 questions. And so I'm going to start with a few. From there, I'll be turning it over to Stephanie Griffin to address some questions about the screener. And then we'll be calling upon our principals will answer some questions, and then we'll look to the nurses. So just bear with us as we work through these. So there was a question regarding the COVID numbers and where we're at. So should the question is, if the numbers go higher than 25 per 100,000 on the 9th, and we have our kindergartners back, will students in grades 1 to 5 be able to return as scheduled? And the answer to that is yes. Once we reopen, we are reopened and we are allowed to continue to bring students onto campus as scheduled. So we do not plan to increase the number of students that we are bringing back on the 9th. We really do want to give each grade the attention, the time, and do this slowly and carefully, which we believe is the safest way to handle that. A related question around how certain are we then that we are returning next week, and what would prevent us from returning at this point? I know you're trying to decide, you don't want to get your children's hopes up. I mean, my answer to that is today is day one, and we know that we need 5 days of consistent numbers below 25. So I would say we're going to, know by the weekend. And I would maybe take the weekend to talk to your children and prepare them. So we can't say that for sure. How certain are we? We're extremely hopeful, and have seen the numbers continue to go down. So, and all signs are pointing towards those numbers continuing to decrease. So I think we're on the right track. The superintendent will be following up with the community, though, just to confirm that we are moving forward with a reopening on the 9th. All right, Stephanie, could you, I know you've seen several screener questions. I'm going to turn it over to you for now.
All right, so I'm going to answer a couple of the screener questions. The screener will go every day to multiple guardians. The people marked as guardians and infant campus will be getting the email. The first email comes around 7 a.m. Then a reminder email comes around 8. And if you do sign up for the text, I love getting mine as a text. It comes at 7:30 every morning. So if I get my text and I'm still in bed, I know that I need to get going, because that's a little alarm for me that I need to be going. So it will go to multiple parents. And the last parent, if multiple parents end up filling it out, the last parent who filled it out, the most recent version will show in an easy way for the school to see. Those unique links in that email or in the text that go out, they are unique each day. So they have information that ties back to the screener about the student's name, the information in that day. So we have historical records, and we have records for that day. Those texts and those that unique link in the text or the email is unique. So every day you'll need to look for that email. The email title or the text you get, the email title will come into your inbox with the title Action Required, and then the name of the student. Action Required Health Screener for Sally, Joe, or Johnny, or Juan, or whatever. So you'll be able to find it that way if you get a lot of email. If you have a problem and you're not receiving that email, use that IC helpline. Maybe we'll need to check and make sure we have the latest email for you and your family. Another question about the screener came up. And as you go through the questions, the first question about the have you been exposed or have you tested positive in the last 4 days is really to set up our contact tracing. So we want to catch somebody who may have recently, even over a weekend, tested positive. So that question allows us to send the user, if you answer, yes, I've tested positive in the last 4 days, it's going to send you to another sort of survey that looks a lot like this one, but it's going to be asking about contact tracing. Where have you been? Who might you have been nearby? So that question leads there. It will mark you as not cleared to come on campus. The other thing, as you answer the questions and you come through and maybe you get to the place where you say whether you're going to be on campus or not, or whether you've had an exposure in the last 14 days to someone who is positive. Any of those questions, if you ever answer in the positive in a way that it would not clear you to come, it will immediately end the survey. So you don't have to answer all those questions every day. If ever at any point it's like, nope, you're not cleared to come to campus, it will stop the questions at that point and show you the red X and say you're not cleared. If you made a mistake, there'll be something right there at the end of survey message saying you can update the link. The other thing I want to add on here, and I don't know if anyone wrote this in, is after you complete the survey, you'll have your end of survey message on your phone, but you'll also get a follow-up email with your results and that link again if you want to take it. So if you take it in the morning and you're doing fine and you've got an afternoon kiddo and they start not feeling well and you want to let the school know we're actually not going to be coming to school, we're not going to, don't count on us being cleared, and you can always look in that email, the follow-up email with your results, and it'll have the update link in there and you can update your records from there. Let me see if there are any other questions. that I need to answer around this. And I think I got most of the ones that were from me. I'll take a look. If there are any more, we can come back.
All right. There was a question about handling how do you respond if you're a medical care provider about the close contact? And that is a question for the student. You're always answering about your child, so that
Unless you're positive, then the child is not a close contact.
correct.
So you're good there.
All right. I'm going to turn it over to Carol Kramer. She is prepared to answer a few questions.
Am I just going to find the question, Cheryl? Sorry.
I'm sorry. Yes. Well, there's a question. What happens? Sorry, here's a question. Will the health clerks be able to answer questions between when a child wakes up and the start of the morning class?
Probably depends on how early your kiddos get up, but between 7:45 and 8:15, you can try to reach them. We're asking everybody to do the screeners 30 minutes before school starts. And that will enable our health clerks to really start working on those screeners starting at 8. So they may have trouble getting back to you, but there is no harm in leaving a message. We encourage you to leave a message, and they will get back to you as quickly as they can. If we have to delay your child starting school on time to get your question answered, we'd rather do that than have you go to the hassle of coming to campus only to find you have to leave. So leave a message and we will get to you as soon as we can. And we'll make sure you have their emails and their direct lines to leave voicemails.
All right, Carol, how will how will we address all the materials that children currently have at home? Asking if there's a space in class where they can leave materials. So
each teacher will specifically tell you which materials they need to bring back and forth. And if this is a particular individual question about a child coming to school and then needing to go to a pod for the rest of the day and potentially needing more materials, reach out to us and we'll problem solve with you. But for the general question, your classroom teacher will tell you what they need to bring to school and what can stay home for the asynchronous part of their day.
All right, next question. Do we have just one DL coordinator for all elementary school grades? What kind of curriculum will they use during the 10 to 14 day period?
So we have two distance learning coordinators. We have one for K1 and 2 and one for 3, 4, and 5. And they'll be using the same curriculum as is being used in all of our in all of our classes, distance learning. We have adopted curriculum for all students.
And given the uncertainty of when school would reopen and vacation plans that folks have made previously, are children able to also participate in distance learning to the extent that the child will be away on vacation, or should the child be absent for that time period that they're away?
So if your cohort is still on distance learning when your vacation starts, that's really no different than what's happening right now, where some people are not in their homes, but are in other places attending through distance learning. So that can continue. Obviously, once we're in person, if you are away, it's like being on a trip any other time, and we don't have a way for you to access school during that period.
All right, I'm going to turn it over to Michael with a couple of questions. Can you talk about where we're at regarding the restrictions on travel?
Yes, good evening, everybody. For reference, I'm going to read you something from the document that was shared yesterday as a reminder of this meeting, the health basics document that our health clerks have worked on that's really fantastic and has a ton of information in there for you as well. And based on, we realize that there's, we're wrapped around a break here with the February break coming up. And Alameda County has urged, and we are urging, against non-essential travel outside of the county. And the county is asking that anybody who does so self-quarantine for 10 to 14 days after returning from outside of the county or the state, if they don't get tested. It is recommended that they do get tested 3 to 7 days after returning. And if you test negatively, then you could return to school after 7 days. But we're just trying to collectively be responsible for the greater good and really encouraging strongly that people avoid unnecessary travel. And of course, if you do, just being smart with distancing, mask wearing, and not having contacts with people that you otherwise wouldn't be in contact with.
And I would add to that, when you return, should your child exhibit any symptoms, again, this goes for everyone for every day. We really are trusting that every family, every parent is responding honestly. That's the way we're going to keep everyone safe, for all of us to indicate if there's any symptom, and a nurse will be in contact and we'll have follow-up questions and we'll speak to you about it. All right.
If I can, Cheryl, to that, thinking about the kids for sure, but the staff too, right? And their needs and wanting to be there for your kids, and just thinking about kind of everybody that's involved in this work as you make those decisions.
All right, Michael, we have a few questions about masks, just kind of calling out that a mask may slip down from a child's nose, or there might be, you know, putting their hands on their face or something. Can you address how that will be handled?
Sure, there's going to be a lot of personal hygiene going on, a lot of hand washing. We have hand sanitizer in all the rooms, and there'll be hand washing going on. So they're little kids. They're going to be at times touching their face for whatever reason. And I think too, the kids overall, what I've seen at school and also outside of school, they're really good at understanding the mask wearing and the importance of not taking it on and off all the time and touching their face when they don't have to. And we realize that's going to happen sometimes. So there's going to be a lot of hand washing, hand sanitizer type of opportunities for kids. And if there's kids that need help, we can definitely help. We will try as much verbally first, of course, but if kids need some support in some way, shape, or form with getting it right, the mask, either it's too big or it's too small, whatever it might be, we can definitely help them out.
All right, there is a question. A few people are asking about where we're at with vaccinations, asking have teachers and staff been vaccinated. So at this point, we could have a staff member who's been vaccinated because they might be, they might have a partner who's an essential worker in the medical profession. But as a whole, we have not yet been vaccinated. We continue to get updates on a weekly basis on where we're at with that. And our nurses have signed us up, PUSD, as an opportunity to have us be a vaccination site where, you know, we put that out there because we have done that before. But at this point, we don't have any confirmation on any specific timeline for when our staff would be vaccinated. But of course, we are continuing, our nurses meet weekly with the county health professionals, and we have regular meetings with them and are updated. Our superintendent meets with the county public health department and the superintendents regularly as well. And so at the first opportunity that's an option for us, we will be pursuing that. All right, I'm going to go back to some other classroom specific questions. Back to you, Carol. Could you share an expanded, well, there's some questions I'll just say related to school sites. So if any of the principals see a site specific question that you feel you can quickly answer, if you could unmute yourself and answer those. But also be assured everyone that the principals will be following up the communication that has references and maps of the school will be available. But if anyone sees a specific question, I see a few of them about clarification around entry points for your sites. So Carol, why don't you take the first one there on line 48?
I think we will all be providing expanded views of our entrance points, and we are all aware that there's situations where older children may be the ones accompanying younger siblings onto campus, and we will work with those families to make sure that an older sibling who's waited to get their kinder or first grade sibling into school will have a path that makes sense for them to get safely to their classroom. So I think I speak for all of us on that. And I know at Wildwood there are multiple entrances, and I promise you I'll reach out with how we're handling that by grade level.
And for Beach, I would say the same thing, that just pay attention to the bulletin tomorrow and any other updates around that for more specifics. And gates and things like that, we'll make sure gates are unlocked, even down at the grassy field, that area down there as well for Beach.
I don't know that there was any Haven specific question in there, but classroom teachers and I are going to be sending out grade level communications and classroom specific communications about Havens. We are going to be utilizing every side of campus for entry. And like Mrs. Kramer said, older siblings are welcome to enter with younger siblings if that's what works best for your families.
And one more question along those lines is, yes, we'll each be coordinating with our own schoolmates program to be sure that kids are brought to the right entries and also escorted back to schoolmates at the end of the day, met at a gate by schoolmates at the end.
All right, at this point, I'm going to ask our host, Mary Leon, if she will please unmute or elevate Carol Menz and Amy Jo Goldfarb and Claudia Garcia, who are our 3 district nurses. And before I ask the questions of them, I'm sure you all share this sentiment, which is that we absolutely feel so incredibly fortunate to have the 3 of them. They are working day and night to help us every step of the way. They have been for months, and we are so grateful. So, Carol, could you answer the question for non-COVID health issues, such as seasonal or environmental allergies that lead to nasal congestion or cold-like symptoms? Are parents expected to get a note from a doctor in order to allow the student to attend school when they have those symptoms? Mary, do we have Carol unmuted?
She said she can't unmute, Cheryl.
Okay, go ahead, Amy Jo.
Okay, maybe Mary can help unmute her.
We'll take the next one.
Hi, everybody. Yes, in fact, because it would be the first time that we would be seeing a student present with those symptoms, which could be COVID. They very well may be seasonal allergies, but because they have the potential to be COVID symptoms, we do need a medical evaluator to attest to the fact that the symptoms are due to something besides COVID-19. And so you would reach out to your provider for that. And then if we have an ongoing situation like that, which many kids do, right? They take various allergy medications and things like that. The site health clerks and of course the nurses can work with you on that sort of seasonal allergy type situation.
All right. Another question for the nurses. If a parent answers yes to one symptom on one day, do you have to get a negative COVID test for your child in order to return to school, for them to return to school for the next day? Or if all the symptoms have gone away the next day, can you return to school?
I can take that one, Cheryl. This is Carol. The problem is that we know many people can be asymptomatic with this disease, right? And sometimes somebody can have a symptom that only lasts a day or two and still test positive. So unfortunately, one day of a sore throat, one day of diarrhea, one day of vomiting, we have to assume COVID unless proven otherwise. So like I said, and if we're assuming COVID, that automatically requires us to have your child isolate at home for 10 days. There are two ways to shorten that isolation period, and that is one, to get a note from your medical care provider, your healthcare provider, but that note has to indicate that that symptom is not related to COVID-19. It can't just be a note that says student cleared to return to class. Okay, it has to specifically address the symptoms. And then the other way is to submit a test result that is a negative COVID-19 test result that is a PCR or molecular test. Like I said, like Anne said before, a rapid antigen test, which you can get in 15 minutes, will not suffice, unfortunately. I would imagine that most, given how many cases of asymptomatic COVID we have seen in the community and quite frankly, everywhere, we will have to really, have to enforce this. And I'm sorry, we know it seems kind of, drastic, but this is the reality. And if we can keep one case out of a classroom, okay, we save all of those kids and that teacher, and not only maybe that cohort, but the other cohort that teacher teaches as well, from having to stay home and quarantine for 14 days.
All right, another question. If a sibling has COVID-like symptoms but doesn't get tested, so then it's unknown of their COVID status, does the child who's going to school need to stay home from school as a self-quarantine?
Do you want to get that, Claudia? Go ahead.
I was just going to say, no, if the student does not have any symptoms exhibiting, like the sibling, that student is okay to come to school. The sibling that has the symptoms would be the one that has to isolate at home, but it doesn't affect the student coming to school. That's supposed to come to school.
All right. All right, back to you, Amy Jo. There was a question asking for clarification when Anne spoke about a scenario when the entire cohort stays home for two weeks. Is it that only if someone in the cohort gets COVID, or is it if someone is exposed to someone with COVID, is the whole cohort staying home?
Mm-hmm. Thank you for the clarifying question. Indeed, it is when there is a positive in the cohort that the cohort would need to quarantine for that time period. If a parent is test positive in the household, the student that is coming to campus would need to quarantine, but that is not a primary exposure by the rest of the classmates of that student. I hope that is helpful.
Thank you. All right, Carol Menz, could you speak a little bit about our surveillance testing that we're doing? The question is, will the school do surveillance or other testing?
We are currently engaged in surveillance testing of staff. We have been testing all of the staff once a month. Elementary staff 1 week and secondary staff another week, with Reopening, there have been some new guidelines that have come down from the state that as long as the adjusted case rate is between 14 and 25, which it is right now, there's a recommendation that we go to weekly testing. I believe it's not a requirement, but it's a strong recommendation. So we are looking at that. And as far as testing students, we are looking at different vendors to help us make testing available for students, for families at this point. But we have not contracted with a vendor yet, but we are very close. Can I just also ask and add another point to something in the previous question, which is that where we have these guidelines and we're kind of specific about saying if a sibling has symptoms, that other sibling can still come to school. There are going to be some exceptions to these things. And one of them would be if there was an exposure within the family. Okay, so if there's a strong indication or a strong suspicion that the sibling who has symptoms could actually have COVID, then we would probably restrict the sibling who would otherwise be able to come to school from coming to school until we get that clarified. I just wanted to put that out there because on the one hand, we're following these pretty strict guidelines. And on the other hand, there are some clinical decisions that will be made regarding certain cases, depending upon what else is going on.
All right, Anne, I'm going to ask you to answer this one. If a child that went to school, and the nurses are on standby to help, if a child that went to school on Tuesday has a runny nose on the following day, for example, does that mean that the full class will shift to distance learning on that Wednesday or Thursday?
Don't know if I understand the question. Can you?
So, and if it helps, go to line 72. I'm reading from there. If a child that went to school, say on a Tuesday, has a runny nose the following, well, it says the following Wednesday, but I'm assuming that means the next day. Does that mean that the full class will then shift into distance learning?
Great question. I'm glad that somebody asked that. And I think I can answer this correctly. I've been practicing. So the answer is no, unless the child gets a COVID test and the test comes back positive, in which case we go to the date of the onset of symptoms and go back 48 hours to do all of the contact tracing. And in that case, the whole cohort would move to quarantine, but only if the child ultimately had the positive test. I think the helpful rule of thumb that's helped me sort of wrap my head around all of this is we're only looking at first degree exposures, not second degree. So a lot of the questions and scenarios that people have put in the questions are like, a sibling of a person who's been exposed. That doesn't really apply. It's only the person itself, the individual who's been exposed or who's symptomatic, that it applies to. Once that person is positive, then anybody they've come in contact with would move into that quarantine period. But you're not going to go multiple steps. So even if there's a child in a cohort who's had to quarantine because of a positive case within their cohort, they may have a sibling in a different grade. That sibling can still come to school, even though the other sibling is having to quarantine because of their exposure. How did I do, nurses?
Great, thank you, Anne. All right, so since we're talking about symptoms and waking up and things coming up and back to the screener. So Stephanie, you may answer this, or one of the principals may also, or nurses. If a child is symptomatic or not able to go to school for the 10 to 14 days, the question is, do they keep filling out the health screener for that period of time?
Hi, Cheryl, I can take that. We prefer if you did continue to indicate on the screener, that'll be the second question, are you coming to campus today? And you would say, no, we're not coming to campus. We do get that first question of, have you tested positive? So you would, if the kid had tested positive, then we would trip that one up and do the contact tracing. If they hadn't tested COVID positive, you would say no, and then that they're not coming to campus. But filling that out every day lets us know that you've received it and that it's been done and you're not on our list of kids that haven't responded yet. So our health clerks and getting the kids on the campus aren't going to be worried that a little Johnny or Joe is that we need to watch for him because he hasn't finished his yet. So just checking those two little boxes to say you're not coming on really helps us. And also it helps us to know if you do if a positive test does occur, it helps us to know that has occurred, and we can then follow up with the nurses and contact tracing.
All right. Carol, could you speak to a little bit more about what the classrooms will look like? So as parents are preparing their children to return, just say a little bit more about what they can expect to see.
So you can expect less furniture in the classrooms. You can expect desks 6 feet apart. You can expect materials for individual students at their desks. There won't be shared caddies with table scissors and markers. Students will have their own materials. Teachers will teach from a 6-foot distance, so they will largely be more toward the front of the room. All of our rooms have their own unique layout, but there will be less moving into students' desks and backing away, but more it will definitely be keeping a 6-foot distance while they are teaching kids and engaging with them and, finding new ways to share the learning in these newly configured spaces. There will be doors open. There'll be some windows open. There will be ventilation that pulls in air from the outside and or air purifiers in the classroom. So that it will be different than it has been. And we will have half the children in the room. So that will be a big change. And Anna, Michael, is there anything you want to add on to that?
I think the only thing that I want to add is, it might feel strange to the older students, but the younger students, particularly the kindergartners and first graders, probably don't know what school is quote unquote supposed to be like. Those are our expectations and norms that we're layering on them, but they don't necessarily have a frame of reference to compare them to. And even a current first grader probably doesn't remember really what kindergarten was like in great detail. And if you have a young child, ask them if they remember before they had to wear masks outside. And I bet you that many of them will say that they don't, or ask them if they remember when they first started wearing a mask. Many of them won't. So I think it's important not to layer on our expectations for what school's supposed to be like and get them excited to be with their teacher and their classmates, because the rest is just going to feel like it's supposed to be to them because they don't know differently, particularly our K-2 students.
If I could just add one thing to that, just as a small sample, a small case study, TK at Beach has been really positive and successful so far. And kids have been learning in this environment and participating and happy and coming to school. And it's being at school, being with adults and being with real people is so important to them, and they really feed off of that. So I think we will see a lot of, although very different, a lot of positives, and just having that connection again with kids and with their teachers is going to be something that is a big takeaway. And then also for just, I can't remember, Carol, if you mentioned it, but if they're for pictures of physical layouts of rooms and things like that, check our slide decks that we've sent out for each site. And I think we'll probably all plan on pushing that out again tomorrow in the bulletin. But it courses in there of pictures of what classrooms are going to look like as well.
And again, just to echo everything Anna and Michael just said, they will be cheerful and welcoming, and they will be better with children in them than they are without. So.
Absolutely. So, all right, I'll take this question, asking if our children in the AM cohort and PM cohort will be sharing the same tables and chairs. So yes, they will. And we have a whole process built in. Actually, when we built the schedule with the knowledge of like what we needed to do to clean the rooms in between our cohorts. So we have a system in place where our custodial staff will be using the electrostatic sprayers in between, spraying all the classrooms. But for the reasons, as we explained about what the classroom will look like and the 6-foot distancing, and that they'll be using the same tables and chairs, but they will surely be cleaned in between. Another question I know I can answer related, this is a smaller population, but just as we've done in the past, if your child is in the PM cohort and they are on campus or they are coming to the rec department programs, the Camp Smart Start or schoolmates, and vice versa, the handing off, so to speak, will happen internally. Yes, we will transport the students to their destination, and we have an internal system ensuring that the students have gotten to where they need to be. We do have a few other questions related to camp and schoolmates, but in the interest of time, because we are at over 90 questions, nearly 100 questions. Any more about the Camp Smart Start, we will respond to in the FAQ. All right.
Cheryl,
Sure.
Can I try to respond back to just really quick about travel? Because it seemed to have prompted maybe more questions than originally we started with about travel. So the language I referenced related to travel is from the travel advisory issued by Alameda County on January 27th. I realized what I said and what's in that language is saying that out of county travel is what I was referencing, as well as out of state. And I think in the end, I mean, I work in a different county than Alameda, so I'm going back and forth each day too for work. But when it comes to travel, I think even separate from everything else is, if you are going out of the county, just wherever it is, just be smart about what you're doing and who you're doing it with, and really minimizing contacts with people that you wouldn't otherwise be in contact with. I think that's what the spirit of this is. And so we're not bringing things back into our community.
All right, I'm going to direct this next question to the nurses. Is there guidance to families who are currently participating in family pods, with guidance to those families to stop the pods if their children are returning to in-person schooling? Can someone take that? Carol?
Amy, yeah, I can address that. You know, pods are only as safe as their weakest link. Okay. And so basically, if your child is currently involved in a pod with 3 other kids, that would pretty much be one of your group activities, one of the extracurriculars. And just a point to note that right now we talked about county guidance that kids could be part of 3 cohorts, a school cohort, an aftercare cohort, and maybe 1 extracurricular activity cohort. This is old guidance. We are expecting new guidance from the state and the county any day now. The state guidance that came out just says kids are limited to 1 sport. We're still waiting for some more guidance on extracurricular activities. However, I would consider a social pod like that to be, one of your extracurricular activities. And I would also suggest that even if you're in a pod, a social pod, that everybody wear a mask and socially distance within your pod, because if you're not, that's effectively your household. And what we have found out is that, people have an idea that, well, I'm part of this pod, so it's okay because we're not seeing other people. But then you find out that one student is one of their kids is part of one pod, and another kid is part of another pod, and another kid's, and before you know it, there's 6 pods, right, that this family is exposed to. And if every other family is exposed to 4 or 5 pods, right, that's a lot of contact. So, so I really want people to think about, and each additional contact that you have like that increases your risk exponentially. Okay. So, so while there's no current up-to-date guidance, I think, on that, I just want you to think about these things in terms of the in terms of your interactions with others outside of your household. My colleague just sent me something. Amy Jo, you want to just jump in there? Sounds like you wanted to say something.
No, I just, I noted in the slide deck, again, just like Carol said, you know, we've been waiting for this recent information and we were hoping to have it from the health officer. But as the counties were left to their own devices for a long time of this, there's wonderful alignment coming into play now with the state. And so things are aligning, which should make it the heavy lifting on the individual counties a little bit easier. But as it relates to these cohorts and a pod, if you will, I would say the spirit, as Mr. Cortone mentioned, of the same idea of like travel is to think about kind of a unpotting, if you will, just to kind of limit that interaction before we're going to be coming together and gathering in the classroom with additional students.
All right, so we have had small cohorts coming back. Anne, would you like to speak to just in general how things are going?
Sure. So, you know, we're part of Alameda County and we're part of the state of California. So we know that we're just coming out of a pretty significant surge. I think what people should really know is that we've had an incredible success with these small learning cohorts. It's been great to have some kids back on campus. It's been great to be able to test our systems and structures to make sure that they're working. You know, we have had to go through contact tracing. The nurses have done an incredible job with that. We've been, you know, interfacing with families and sending out whole community, whole staff notifications when there's been a, you know, potential exposure. And I think what I've learned the most from these instances is it's really easy to get worried and emotional. It's a normal response. But fishing for information and trying to figure out who was the person who exposed and all of that is really counterproductive to our ability to do our work. And, you know, potentially damaging and ostracizing for the child or the family who was COVID positive. People are getting sick who did nothing wrong, who just went to the grocery store, to the doctor's office, or went for a walk around the block. You know, we know that there are cases where people were not engaged in risky behavior and still got sick. And so I think we need, as a community, to give everyone the benefit of the doubt. And when we find out that there was an exposure, to let us do our work and go through our contact tracing process. You are going to get the information that you need for your child and for yourself.
Cheryl, I want to add to something that came up earlier, and this is about children finding each other at the end of the day. I think at all of our sites, there are a couple things that, you know, are always true, is that having a place to meet up as a family group is a good idea. We are very much encouraging parents, when you have your children or when they're walking home, to walk home and to really talk to your kids about not congregating on the way home, and advising you the same. And with our focus on health and safety, I think it's super important to remember that our traffic flows and our quick loading people into cars and exiting really ensures the safety of all, and those things will remain very true now, even with smaller groups of kids back at school. So if you haven't kind of sort of made a plan for where you're unloading your kids and where they're finding you at the end, that's a really good thing to do before the first day.
All right, thanks, Carol. All right, there's a question about the community care agreement and what happens if someone doesn't sign it? Can your child go to school? So I just want to say the community care agreement is something that was developed by parents in our community who were, are part of our parents club leadership. It was so very much appreciated by all of us that we came together, and this was drafted and sent out as sort of a model of what we're striving for everyone to care for one another and to agree to all of the health standards that we have all been hearing about for 10, 11 months now. We're not asking everyone to sign it as a condition and saying, if you don't sign it, your child can't come back. This is our way of putting it out there. This is what we know is the best practice. This is what we know will keep everyone the safest. And so we're asking you to take it to heart and to follow it daily, right? It's how we're all going to stay safe. I assume that another question that has come through, or some of the questions about travel, these come from people who are very much rule followers. Many of us are, and we want to get it exactly right. So questions coming in. So if I travel, am I required to quarantine? Again, we're just going to say you have made decisions about what is best for your family's health, mental health. We know families made plans and have plans to travel. We know you're going to do it safely. So we are not here to tell you, what you can and cannot do. We are not imposing restrictions and restricting children from coming back. Children are in classes telling their teachers right now where they're going. So they're excited, and they know that their parents are going to help them travel responsibly. You are going to travel responsibly. You're going to mask and social distance and wash hands and all of those things, right? And you're going to follow all that, and then you're going to return. We want everyone to return safely. We know your children are going to come to school, but on that morning, should any symptoms arise, we are trusting that you are going to answer the screener questions honestly, and we will follow up, because again, any symptom needs to be treated as if it's COVID for all of the reasons that we've outlined there. But we are not saying you cannot travel. We are not saying that you must quarantine. We are asking you to follow all of the guidelines. Amy Jo.
If I might ask a question, Dr. Wozniak and site principals, a friend just texted me a question that I really cannot answer, and it is about crossing guards. And will our crossing guards be resuming at the normal posts and during those times that kids would be coming to and from school?
All right, does anyone, so just to acknowledge that we're at 100 questions, and there are some questions that we're seeing come in that we may not yet have answers to. So any of our principals, do you have a response for that? Because if not, again, the questions live in this form so we can follow up.
I think I can just, go Michael, you.
I'm just going to say that I think that's something that we can do a follow-up question response to. Is that what you were going to say, Anne? Great.
All right. And I just want to share my appreciations for the very nice comments that folks are also dropping in that aren't questions, but thanking us. I do agree. Our staff, our nurses, our principals have been doing a fantastic job. It is no small feat doing all of the things to prepare. We've been working for months behind the scenes. We are so happy and excited that we are at this point. We will continue watching the numbers. And again, we really look forward to your children being back with us. There will be things that come up. That's the thing, right? We have all of these plans, and we've tried to think of everything, but we're human. We can't possibly have thought of everything. So just in advance, on behalf of all of us, I'd like to thank you for your patience, for your understanding, that and just know that we are going to get through this together. And plans that we've made, if we find out that they're not working as we thought they would, we will adjust, right? This is a moment in time in history where we really have a chance to model for our students our own resilience, our own ability to be flexible and supportive, and just assume positive intent of all of the people who are doing everything they can to support your children. And I know that our teachers, all of our support staff, everyone is very excited to have everyone back. So with that, I just want to again thank you for your time this evening. And we are going to close our meeting, and we will be following up with the questions that we were not able to answer live, and put those in an FAQ and get those out to you. So good night to all, and we'll see you next week.
At this point, Dr. Bosniak, should we just end the meet? I mean, end the Zoom?
Hey, Steph.
Yeah, do you know how? Yeah,
I'm removing people. I just have to do it individually.
Yeah, I saw that. Okay. I'll see you
Okay.
guys later.
Now,
All right.
Steph, it says live on YouTube.
Yeah.
Should I stop that or
It will, the direction said it will end when
the
we
when
end
the
the meeting.
ends? Okay.